We're going to start today's health assessment with the head and the face. We are going to palpate the skull. It is normocephalic. We are going to check the scalp for any infestations. There are no infestations, no lesions all throughout the scalp. And we're going to now inspect the face. It is symmetric and proportionate. Nothing is abnormal or large. Skin is smooth. Now we're going to palpate the temporomandibular joint. Can you open your mouth, please? Do you feel any tenderness?
No.
Okay. And the patient has full range of motion. We're now going to palpate the maxillary and frontal sinuses. You're going to tell me if you feel any tenderness.
Okay.
You feel any tenderness?
No.
Tenderness?
No.
Okay. Now we are going to inspect the eyes. The eyes are symmetric. There are no lesions, no discharge, and they are not protruding. The eyebrows and eyelashes, there are no infestations. The eyeballs are aligned, and the iris is brown. Now we are going to inspect conjunctiva and sclera. If you could look up for me. Conjunctiva is pink, sclera is white. Now we're going to test perla. Pupils are equal and round. If you could look right here. I'm going to hold a pen out here. Both eyes constricted evenly. And now, could you look at my fingers? Look at them. And accommodation was perfectly done. Perla is present. We are now going to inspect the ears. We're going to start with the external ear. They are symmetric and proportionate to the face. There are no lesions and they are midline. I'm going to palpate your ears for tenderness. Tell me if they feel tender.
No.
Now we're going to inspect the external auditory meatus. If there is any. There is no swelling, no redness or discharge. No swelling, redness, or discharge. Now we're going to inspect the nose. It is symmetric and proportionate to the face. And there are also no lesions. Now I'm going to palpate for tenderness. Any tenderness?
No.
Now we're going to inspect the nasal cavity. It is a normal red. It's moist. There are no foreign bodies. There's no swelling or bleeding. Now we are going to inspect the mouth and throat, starting with the lips. They are pink, they're moist, there's no cracking, no lesions, and the lips are aligned to the face. As for the teeth, can you say aw? All teeth are present, they are clean. Now we're going to inspect the tongue. It is pink and smooth. Now the buccal mucosa, pink and smooth on both sides. Can you say aw? Tonsils are pink and smooth as well. No lesions or bumps. 1 plus. Now we're going to inspect the neck. the neck. The neck is symmetric to the body. It's midline. There are no bumps. There's a pulse, no masses. We're now going to palpate his cervical lymph nodes, and you're going to let me know if you feel any tenderness, okay?
Okay.
Do you feel any tenderness?
No.
Now we are going to palpate his carotid pulse. +2. And that concludes our health assessment.